the complication of the diabetes that can lead to the problems throughout the body. Diabetes can affect the nerves that control the movement, sensation, and other functions. And this, the causes of diabetes is due to high blood sugar, due to metabolic factors, and inherited factors. Usually, the diabetes give rise to the microangiopathy, and that the microangiopathy causes the blood vessels which are supplying the nerves, they are damaged. And that's why the nerves are also damaged. And the nerves are also damaged by the toxic materials due to the hyperglycemia. And there may be some the inherited factors also. Some peoples are more susceptible to the diabetic neuropathy. Now, the symptoms are usually, it may be a focal neuropathy depending upon the what is called mononeuropathy, depending upon the nerves involved. It may give rise to angina, heart attack, appendicitis, or it may give rise to single nerve involvement, pain in the thighs, pain in the legs, pain in the hands, and there may be double vision, there may be hearing problems, and there may be sexual inability and aching behind the eyes. These are the different features depending upon the nerves involved. Now, the most common was the diabetic polyneuropathy, which typically, the longest nerves are affected, the nerves of the legs, feet. Usually, there is a sensation of the unusual sensation, tingling, numbness, and soft pains and cramps, extreme sensitivity to touch, and insensitivity to pain and temperature changes. And this increase insensitivity to pain and temperature may give rise to sometimes the damage which cannot patient realize, especially in the legs, giving rise to the diabetic foot ulcer. And it may give rise to diabetic gangrene, also giving rise to amputations. Now, because it inhibits the ability to change the problems, that's why the damage occurs. Now, the diabetic autonomic neuropathy, usually there is affection of the organ, that is the systemic organs, heart, digestive system, sexual organs, urinary tract, sweat glands. The kind of diabetic polyneuropathy can cause symptoms such as the persistent nausea, vomiting, diarrhea, constipation, sweating abnormalities, sexual dysfunction, digestive problems, low blood pressure, and impaired perception of the pain. Even it may give rise to hypoglycemia. Now, the neuropathy, or diabetic neuropathy, usually diagnosed by checking the muscle strength, reflexes, the muscle sensitivity to position, vibration, temperature, light touch, and ultrasound to determine the parts of the urinary tract of functioning, electromyography, nerve conduction velocity, and skin biopsies, nerve muscle biopsies for histopathological examination. Now, the treatment of the diabetic neuropathies consists two stages using the lifestyle changes and sometimes the medications to achieve the optimal diabetic control and symptomatic control of the pain and other complications. Now, controlling blood glucose levels, we know the proper treatment like lifestyles, diabetic medications, improving the other risk factors like the dyslipidemia, triglyceride, cholesterol, in addition to the treatment, proper control of the blood sugar, as well as the other risk factors. Thank you.